But thank you for being here. So we're going to talk to you about our doctoral experiential component and our big changes that we've made at Ohio State. How many of you are OTD, entry-level OTD graduates? Yay, high and proud. Where are you from? WashU. I've heard they have a good program. Toledo also has a good program. Toledo also has a good program. And we have an OTD student from the newest program in Ohio from Kettering. So that's very exciting. So you're doing your level 2 fieldwork?
It's my second level 2.
Your second level?
My doctoral experience at the NDA clinic here.
Oh, very cool. Wow. Well, very good. So we're very excited about some of the changes. We're going to just discuss what some of those things are. So to start, we always start with a commercial at Ohio State. So we are having our 75th anniversary party, which is November 10th, which is the day before Veterans Day and is a state holiday. Is it a holiday here? No. See, sorry to bring it up. But Friday, November 10th at the Eddie George Grill, it's free, and there's free booze and food. And they're not going to ask you for money. We've insisted for our Alumni Association that they're not supposed to ask for money, right?
Theoretically. I think there's going to be stuff there, but not an overt ask.
Exactly. So come, it'll be fun. So free is always good. So that's our little advertisement. So what we're going to do today is talk about the OTD and why we made the decision at Ohio State to transition to the entry-level doctoral program. Talk about our version of the doctoral experience, and it's different really than Toledo and WashU and from other programs because America, and we're all a little bit different. We're going to specifically differentiate the doctoral experience from fieldwork because it's very different. How many of you have been able to mentor a doctoral student here at Nationwide? So hopefully you were able to see that there are hopefully some significant differences between fieldwork and the doctoral experience and why it's really important for us to distinguish what those are. And then we're also going to talk about opportunities here at Nationwide for some doctoral experiences within your various settings and how different partners that we're working with are using this. So these are two of my favorite graduates that we've ever produced from The Ohio State University. Nancy Prendergast is the lady. And then, anyone hear about Bro T? Remember Bro T? It was very hip a few years ago. So it was like to increase diversity in OT, but maybe extra males specifically. So Josh on the right is the founder of Bro T. Anyone have any idea what they might have in common? They're both OSU graduates.
I know.
What do you know, Kelly?
They're both cheerleaders.
They are both OSU cheerleaders. Nancy Prendergast, class of 1954. I think we're allowed to say that in public. And Josh, I don't know, 2005, 2006, something. Unfortunately, Josh left us and went to Jefferson to do his OT degree. But so again, just showing you that we've been around for a while, and we have a diversity in alumni that we produced. The other cool thing about Josh, he was both a male cheerleader, obviously, but he also walked onto the football team. So he's the only person in the history of The Ohio State University to both be a male cheerleader and a football player. So there you go.
I have a lot of questions.
What do you got? And now he's, where is he now? I don't
know.
He's in D.C., I think. What's that? Yeah, Sarah wants to know where he is right now. Anyway, so there you go. So that's Nancy and Josh. So I put that up just to tell you that we've been around a while, have almost 3,000 graduates. And so every now and again we've refreshed. And so we certainly are in a period of refreshment. Is that the right term? Absolutely.
A good way to put it.
That's right.
How many bachelor OTs are out here? Okay, a handful. Good. Me too.
Me too. So there you go. So we had a master's program for about 15 years or so, and now are about to produce our first OTD graduates coming up this spring. So just to talk a little bit about that little issue, licensure is granted by the state. So once you're licensed, NBCOT, ACOT, AOTA has absolutely nothing to do with your license. We encourage membership, certainly, but it's really up to you and your sense of responsibility to the profession to maintain that. But with some of the changes, have you heard about some of the changes that have happened lately within the profession? It doesn't affect you. So we're going to talk a little bit about the various degrees now that you can enter into the profession of occupational therapy. So we start with the associate's degree. So for an occupational therapy assistant, it's typically a 2-year certification that you get at a community college. Community college, we'll just stop there. We'll just say at a community college. Other points of entry, like Erica and myself, the bachelor's degree in occupational therapist, or for occupational therapy. So a few weeks ago, is it a month ago now? About a month ago. So this is being recorded for future broadcasts. So ACOTE might change their mind again. So look at ACOTE just to make sure. So for about a month, there was a statement that came out from ACOTE mandating that occupational therapy assistants by the year 2027 would have to transition to a bachelor's degree. And at the same time, we'll talk later that the occupational therapist degree would have to transition to a doctoral degree by 2027. OT assistant programs specifically, many of them are in community colleges, which by definition for most of them, is a 2-year degree. So a lot of programs were saying, we will have to shut down. There's no way for us to be able to deliver a 4-year degree. ACOTE, I think, was hoping and may at some point hope again that they would be able to partner with different universities to be able to maybe do the 2 years, to finish up OT, MOT, MS folks. So there you go, lots and lots. And now there is the entry-level occupational therapy doctorate. So that is now required. It's under advisement at this point. It looks like that is not going to change, but you never quite know.
There's not as much unrest with that one.
Absolutely.
As there was with the bachelor's degree for OTA. It was a pretty big deal.
Yeah. So, and even just behind the scenes, I think there's one program that said they would not transition within Ohio, but by and large, all the programs in some way, shape, or form were moving forward to move to the clinical doctorate, entry-level clinical doctorate. There are post-professional OTDs. How many of you have a post-professional OTD or in a program right now? Very good. So if you have questions, Eric and I are both proud graduates of post-professional programs. Afterwards, we'd be happy to talk to you about that. And then we have an OTD PhD program at The Ohio State University, which our own Dr. Kelly Tanner is a proud graduate from. And so those right now are the points of entry. So there's only 6. Occupational therapy, we love being client-centered, student-centered, program-centered. So there you go. Lots of options for us. So to talk specifically about Ohio State, so this is when OSU grads with a master's degree are going to be a little upset with us. So I'm sorry about that. So specifically to us, we really were thoughtful about this. There's been a lot of criticism of academic programs that have made this transition. I was part of one of the surviving faculty. They're still at Ohio State when we made that decision. And so for us, we really tried to make it as economically viable as possible. And so when we made this decision, and I've told this story, so if you've heard it, I'm sorry to tell it again. We had a retreat, and it was somebody at Ohio State that is in charge of curriculum really for the entire university. So he sort of led us through this process. Is this something we should do or we shouldn't do? How many of you have masters again? Any idea how many credits you had for your master's degree? This is when you'll get angry. 75 to 80, depending on the year of graduation at Ohio State. So a typical master's degree, so for example, we have an MS in allied health, even though we're the School of Health and Rehab Sciences, it's still a master's in allied health, that is 40 credits. A doctoral degree at Ohio State this is when you're going to get mad, 90 credits. So the first slide he put up is he showed our 80 credit curriculum. He compared that to a typical master's curriculum at Ohio State and a typical PhD at Ohio State. And so he said, I'm with you all day. You were paying his salary, I think, regardless. But he said, your students are doing doctoral level work in terms of credits. I think that you should give them doctoral level credit for what they're doing. And I think at at the retreat, about half of us thought that was a good thing that we should do, and half of us thought, maybe that's not the best thing that we should do. But really, after hearing that, it really changed all of our minds. To really look from a purely academic standpoint, we were giving a clinical doctoral degree. And so from that, we've done our best to be able to, again, make it as affordable for students as we can. So the changes that we've made, about 70% of that 20 credits is really is this doctoral experience. So if you really look at the significant difference between the education that you got with a master's degree and those who are graduating with an entry-level OTD, most of it is the doctoral experience. We've certainly changed our curriculum. We've added more specialization, higher level. Some of the courses that students have after they come back are at a much higher level than what our master's students were able to do, just because we now have students that come back for courses after they've had level 2 fieldwork. So their expectations, their ability to engage with content is just at a higher level because they have that practical experience. So students typically would graduate in December. They now graduate in spring. So they graduate around May 1st or so. It's two extra semesters of tuition, which is $15,000. That's not insignificant. I certainly understand that. There's the opportunity cost of 6 months of not working. I understand that. But again, for us, we tried to make this as feasible as possible financially. And that was really Jane's insistence, is to really try to make this as feasible as possible. A criticism of transitioning to the clinical doctorate is that it actually decreases diversity, because the higher the degree level, typically the less diverse the applicant pool, the less diverse the students who enter those programs. We actually have had the opposite. In transitioning to the clinical doctorate, we have started to do a holistic admission process. We're interviewing, so we interview about 120 students, and we take 44 to 48 depending on the year. And so I know some of you have helped with some of those interviews. It's a really phenomenal experience. And so we're still not a hugely diverse group of our students, but we're now at about 16% diversity in terms of our current first-year class, which is higher. Typically, we were at about 4 to 8% diversity. So that's a big thing. So we're coming back, I think, after the first of the year to tell you specifically about our holistic admissions process, which counts for your ethics. So come back and hear us again. So we literally wrote the book on why we thought you should do this, or we should do this as a profession. And so I'll just kind of give you some of our reasoning, and we'll see if you agree with us or not. Would you say, those of us that have been practicing a couple years, that the complexity of the patients that you're seeing might be a little higher than what it was when you first came into practice? I'd like to tell the story of Bobby, who was a wheelchair vendor at Columbus Medical, who had a pretty significant spinal cord injury. When he first was injured 30 or 40 years ago, was at Dodd for over a year. The typical length of stay for someone at Dodd right now is 2 to 4 weeks, even with a significant spinal cord injury. So we are getting people back into community settings more quickly. And then obviously with obesity, with diabetes, with a lot of the comorbid conditions, the kids that you're seeing that are now surviving in the NICU at a much younger age, that then are going to have conditions that are going to be with them for the rest of their life. So we're seeing some increased complexity. All of us are under more pressure to really collect data and to do something with that data. Little plug for our students, they're really great at doing this. And so we had a great meeting with one of our geriatricians at the OSU emergency department earlier in the week, who basically, so we have OT and PT and emergency department. I don't know if you have that here or not. For our folks, it's more fall related, that sort of thing. How can we divert them and not have to admit them if they don't need to be admitted? So there's OT and PT that's in the emergency department. They have data, but they don't really have a lot of resources to be able to analyze that data, analyze trends, and really help. So we met with her, and she basically said, how many students can I have? She would really like to do something to be able to have some of that clinical practice experience, but also let's look at some trends and how can we help with that. The other thing is really looking at evidence-based practice guidelines, and here they're called
Evidence-based summary and
There you go. So, there you go. So one of the ways that we're different than some other programs is that our students are working on developing some clinical guidelines. It's not going to be necessarily at the same level that yours are at because these are students, but they're doing systematic reviews. They're doing a lot of in-depth analysis that they can be mentored with their faculty mentor and a doctoral experience mentor to help with that. So again, OT students can. Lots of emphasis on health promotion, and then emphasis on care coordination and interprofessional partnerships. So we think that we need to have students that have advanced skills in clinical care. And so we'll show you how some of the ways that we're trying to do that. Understanding outcome measurement, we all understand that. Use evidence-based practice consistently. So when we look at one of the reasons that we went through this, if you remember back 5 or 6 years ago with sensory integration and when Medicaid and some insurance companies were starting to deny that code universally. So Jane K. Smith, I had the phenomenal privilege to be her next door office mate. And so Jane was asked by AOTA to try to defend occupational therapy practice within sensory integration. And so the insurance companies turned over documentation that OTs were demonstrating. And so the claims that they were making, the recommendations they were making, weren't based on evidence. And so an insurance company saying, there's really no evidence to show that this is effective, how we're not paying for that. So they started in Minnesota really to almost deny any claim for any OT that was working with a child. And so when she saw that, she would come into my office, she would show me some evaluation or some documentation, and she would be like, because my relationship with Jane was basically to nod and smile, and that was kind of it, and agree with her. And so she would just say, how is this person, how does the OT think this is the right thing to do? You know, how is this what, you know, they should be doing? She would kind of, and then she would go, rah, 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 and she'd smile, and then she'd turn around and go back to work for another 80 hours for that week. So, so she really saw that the doctoral experience was a way to embed evidence into practice. So level 2 fieldwork, we'll talk to you about some of those differences, but a real emphasis for us is to give the student time within their doctoral experience to be able to analyze evidence and to apply it to practice. And then obviously leadership skills. Our students kind of joke all around that we say the word leadership too much. But it's really important that we have to really build and develop leadership skills as we look at how healthcare is changing. And so that's that again. For us, we really saw it as necessary to help lead the profession. Again, we have to be able to apply evidence. So just to clarify, this is not research. So research is the development of new information. The doctoral experience is the application of evidence. So it's finding research that's been done by other people, applying it to practice, trying to use the best evidence that you can find to apply that to practice. So within some of the national stuff that's going on, they're like, how is an OTD student expected to do research? They're not. This really is about applying evidence to practice. That being said, there might be a couple that are interested in doing that with your consent, faculty members' consent, that sort of thing. The OTD allows for more professional autonomy. When I was going through this decision, my lovely daughter was being seen by a psychologist up in Cleveland. And I just really appreciated how the psychologist had so much autonomy in terms of diagnosis that she used, the codes that she used, the billing that she used, that really was kind of evidence-based in how she made those decisions. And so she was allowed to do that. We love our PT friends, so Michelle, we love you. And so, you know, PT has worked very hard for a long time to get direct access, right? So you wouldn't have to go through a physician. We've had it from the beginning of our profession in Ohio, and really from the beginning of our profession. So we think that, especially with some of the changes, the Affordable Care Act will continue, right? Is going to, again, allow us to have more opportunity in new and exciting areas. It allows for advanced skill in a particular area. So for you, especially, you know, in the NICU, burns, feeding, are skills that in level 2 fieldwork you might get a little bit of experience, but this is an opportunity from some of you that are really in highly specialized areas that maybe are not appropriate for a level 2 fieldwork because it's not entry level. But if for a doctoral experience student, might be a great fit. There has been a trend in healthcare to move to other professions. So this is kind of a main criticism, is that we're doing this because PT did. And behind the scenes as a faculty, what we started to think about from a management decision. So is an employer more likely to hire someone with a clinical doctorate than they would someone that has a master's preparation? And so we're actually starting to see that. So there's some places that will hire like an OT with a master's and say that you have to get an OTD within a certain period of time. So that is starting to happen a little bit within the master, or for master's level managers. So then just a little bit the politics nationally. Initially, a couple years ago, the AOTA Board of Directors said, oh, we should do this. Everyone got mad. ACOT voted not to do it about a year ago. And then, literally out of the blue, about a month ago, said, yeah, we're going to do this, and we're going to have the OT assistants do the bachelor's thing. So again, we talked about the OT assistants, but for now, we are back at 2027. We're going to do this. So again, for us specifically, we already thought that we were providing a doctoral experience. And very specifically for us, we see it as Jane's legacy. She saw it as her legacy. So as she was, receiving treatment for cancer, the two things that she continued on were her textbook, which came out. She got a bound copy right before she passed away. Obviously, supervising her PhD students, but also writing our curriculum for the clinical doctorate. So we really do see this as her legacy. Any Ooey Pooey grads from Indiana University, Purdue University? Oh, that's right. Erica's an Ooey Pooey grad. Congratulations. So Tom Fisher was her best OT buddy in the profession. And so he called her when she was doing well until she wasn't. So really until about the last 2 weeks, she felt, and we all felt like she was going to kind of ride through this successfully, or, longer anyway than she did. And when she took a turn, he called her and he said, what can we do, or what can I do to continue your legacy? And so Jane, being Jane, said, Tom, we really need to move to the clinical doctorate as a profession. So Tom said, isn't there something easier or less controversial that you would like me to work on? So anyway, so we really do see it as our legacy. So I'm helping lots of other programs around the country that are starting to look at developing their OTD. So we're sharing all of our documents so they can enjoy the fun that we did. And again, leadership is a key to this. If you look at the accreditation standards for the master's program, the word leadership is not used one time. So the leadership standard for the OTD is used about 25 times. So ACOT really was differentiating leadership as being a trait of the OTD and not of the master's program. We know that that's not true. We know that a degree doesn't make you a leader. But from us, in terms of where we saw we wanted to provide education, we thought that that was important. So these are our curricular threads. Excellence in clinical practice, we think that's the bottom line. Effective translation of knowledge into practice, and then professional development and leadership in practice. So our curriculum now, it's hands-on early. The first semester they deal with cadavers. After that they deal with live people the entire time.
And thank you to those of you that are helping out with our first years. Are you going to say that?
No, but you can.
Yeah, so we added that new half-day first-year experience, so I know several of you in outpatient have been helping, so thank you so much. The students have been loving that experience. It gets them to see clients right away, to get to see an OT right away, and I'm really excited about how that's going to change our conversation about where they want to go for level 2 fieldwork. Because up until this point, the last couple of years when I've been doing this, they've not really been out yet, and so they're making decisions based on their volunteer hours. So I think this is just wonderful, so thank you.
Absolutely. So I guess I did say that. So thank you for all of that. For having our students giving lectures and all the other phenomenal support. We're really lucky to have just an awesome community of OT that we are in. Not every program has that. And so we're really, really fortunate to have that. So we're having these in-class patient labs where we're bringing patients in. So especially in our adult neuro, and obviously we've always done that with kids, and bringing your child to OSU for the day, so our students can do the Bailey on them. So they have clinical simulation labs each semester, community labs, and fieldwork throughout. We've added advanced classes in pediatrics and neuro, and so really what it's looking like, I just added this up. It's about 1,800 hours of clinical experience that our students are going to come to you as a new employee with. Significantly different than when we were a master's program, very different, and really, I don't know of another program that's doing that many hours in the country. So we're really fortunate, especially that the faculty supervised practice, so that's when they're coming in with you, doing those kind of things. So there you go. All right. This is when we have our awkward switch.
So I'm going to talk a little bit about the curriculum. And so this is our current OTD curriculum, and you can see off to the side what is pretty much the same as what it was as an MOT. Now that's not to say that there haven't been significant updates within each of those courses. This is my third fall beginning this here at Ohio State, and every semester in talking with faculty, there are new things being added and changed within courses, and those of you that are helping teach know that. The other thing that is new within this part before they go on fieldwork is that we have 2 fieldwork preparation courses that were not really, there was one there before and then it was gone and now they're back, and so we're running level 1 fieldwork alongside fieldwork preparation, and the point of that is to really help students digest what they're seeing in the clinic and apply that to what they've been learning in the classroom. And it's so interesting. So this semester they did their physical function course 40 hours, and then they're doing their 40 hours in school-based fieldwork right now. And so as they come in and I say, okay, how was it in the clinic? They're like, oh my gosh, I had to go back and look up developmental milestones. It's like, yes, you need to know those. Or I had to go back and look up what an MCA stroke was. So it's just really nice that they're seeing those, that they're making that connection instead of it just being something that they learn sitting in a seat. They're making that connection before they start level 2 fieldwork. And our goal is that hopefully those first couple weeks of level 2s, they're not having to go back and look for all that. So we're having them put together binders for themselves, a fieldwork prep plan of what they need to have on tap. So anyway, that's really sort of the biggest change, I think, within the MOT. The other thing is they start to build, whoops, you don't have it on that one. So they go do in level 2 fieldwork. And when they come back, they take supervision and consultation, which that course has been revamped, to talk a little bit more, about how to consult as an OT. And then they have their management course. They do a program development proposal, and then they finish out their capstone proposal. So they're really doing that literature review and honing what that PICO question is. And then they take an advanced topics course. And I got a chance to sit in on the advanced topics in pediatrics, and it was so much fun. It was like sitting around at lunch with some OT friends and talking about stuff that you don't have time to talk about. Right? And then really relating it back to what the current evidence is. I would imagine it's probably like your journal clubs might be and that kind of thing, where a lot of other places don't have things like that. So like Dr. Cleary said in the beginning, the level of learning is so different when these students come back from fieldwork. And even they've said that they've really enjoyed coming back. They were a little nervous, right? I don't know, I'm going to have this time away from clinical practice, but I think it's really deepened their learning and their ability. Now they have an idea what that client looks like. So the student that I'm supervising is looking specifically at pediatric burns, right? And so now that she's been out in the field and has seen some burn patients, she's coming back, she's taking this advanced course in pediatrics, and she's finishing out that capstone proposal, and she has this picture in her head of what a client looks like that she didn't have before. So then the final thing that they do is they go out and complete this doctoral experience. And while they're on that doctoral experience, they get to, again, see hopefully a piece of that patient population that they've been studying. And then they graduate. Well, they have to come back and defend their capstone, and then they graduate. So just an overview of where does this capstone come in? So this capstone is that systematic literature review on a clinical problem. And it's what we want clinicians to do. What is this clinical problem that I need to treat? And what is the best evidence that's out there? So they begin this process in autumn year 2, which is right now for our second years. In the summer, That's when they learn the whole process. Fall is when they start to come up with that PICO question, do the comprehensive search of the literature, and they're starting to think about where they want to go for their doctoral experience. And the capstone, we want to relate to the doctoral experience, but it's not supposed to be the whole thing. It's supposed to be one piece of it. So that's what they're doing this fall. They're writing up that, beginning to gather the literature. By the time they leave, they've got their PICO question and their literature and kind of an idea on where they want to go do their doctoral experience. Then they go do level 2 field work. And then they come back in the autumn and they refine that capstone. And it's been so interesting to work with my student now that she's back from level 2. She actually was really able to change up that PICO question, and as she was writing up her background in literature review, it made so much more sense to her than it did last year. So then they begin that doctoral experience in December 1, and they go for 4 months throughout. And that's when they implement their capstone, hopefully. So really what I get to talk about is sort of that difference between fieldwork and doctoral experience, because it's this whole other clinical piece, right? It's 16 weeks instead of 12. Well, shouldn't it just be another fieldwork? And I think that a lot of places, if they have not had experience with a doctoral program, you don't really know, and you just kind of treat that doctoral experience student like a fieldwork student, because that's what it should be. So really, if we look at the goal, as written by ACOTE, the goal of level 2 fieldwork is to develop competent, entry-level, generalist occupational therapists. This is someone who can come in, do a basic evaluation of your pediatric client, and come up with some goals, right? At Ohio State, our students come to you for their doctoral experience at entry level because they've essentially had the MOT curriculum, which is typical for a new grad. So then the goal of the doctoral experience component is to develop occupational therapists with advanced skills. Those are beyond generalists. So that's, as he was mentioning earlier, that's really looking at specifically burn care or feeding or NICU management, maternal infant bonding. So all those things that when you've got that level 2 student, you go, oh, that's really tough for you to get just yet. So those are the kind of things that we want you to think about as being doctoral experience topics. Does that make sense? So here it is, just kind of in a chart, which I think helps some people too to see what's the difference. So who's administering the fieldwork is me, the fieldwork coordinator. The doctoral experience is Dennis, the doctoral experience coordinator, director of experiential education.
It got me no pay raise.
No, just a fancy term.
Yeah.
Supervisor term. So on fieldwork, you're a fieldwork educator, right? You are teaching that student, you're educating them on how to do general practice. On doctoral experience, you're really a site mentor. You're providing resources to them, you're guiding them towards different things, but really they have those clinical skills intact. So the fieldwork is 12 weeks full time. The doctoral experience is 16 weeks. It does have an hours component. You have to hit 640 hours. The credential of the supervisor for fieldwork has to be really an occupational therapist. For the doctoral experience, it may or may not be an OTR. As far as productivity goes, in fieldwork, there's really a focus on that, right? Get that student up to being able to handle that full caseload. What does that look like? How do I manage 8 clients in a day? What if no one cancels? When do I get my documentation in? How do I clean up the toys, put the toys away, all those things on top of being able to manage that behavior of that kid and get what you want out of that session, right? Doctoral experience is not really focusing on those skills, and the student may or may not bill for their actual services, so they may be doing a whole lot of other things that you, in your head, you're like, I don't have time to do that. I want to do that. And so your student can help you. Doctoral experience actually only needs to be on site 80% of the time. So the other 20% might be doing things like the systematic literature review or working on some additional projects that you have for them. So what are they doing? So if they're not providing direct services, what else are they doing? They could be really working with an organization, so working with your hospital on establishing or working with Dr. Tanner on those clinical guidelines, or working on staff training modules, creating additional parent caregiver handouts and education programs, maybe then running some of those education programs that are going on. The learning objectives for fieldwork are really developed by your site, right? So what does entry-level practice look like for you here at Nationwide Children's in your outpatient or home health or inpatient? What do I expect someone to be able to walk in and do? The doctoral experience is developed more by the student and what their interests are, but with input from you and from their faculty member that they're working with. And then how do we evaluate them? So you're all familiar with the FWPE at the end of level 2 fieldwork. So for OTD, it's individualized. Each university gets to decide how they're going to evaluate that student at the end of the doctoral experience. So we at OSU have 5 goals that are created on our based on our OTD curriculum, and then the other 3 goals are student specific. So one is usually developed maybe kind of from that site mentor about what do you want that student to help you do, or what do you want to see that student's clinical skills look like. And then the other 2 were developed by the student, again, usually with input from the mentor and the faculty. Does this help a little bit? Kind of differentiate the 2. That fieldwork is really that entry level, and doctoral experience can be that deep dive without the focus and the need to do all that productivity piece. Yeah.
When are they taking the NBCOT after the doctorate?
Right. So in order to be eligible to take the MBCOT exam, they have to be finished with all of their curricular coursework, and so because they have to finish out that capstone when they come back, they'll be eligible to take it then at the end of their doctoral experience. Yeah.
I have a question about the requirement for the students to do a systematic review.
Mm-hmm.
So is that like according to like PRISMA guidelines? Is that
Yes.
publishing at an AOTA, or is that more of like a structured or scoping literature?
No, we're actually doing a legit systematic review with a Prisma flow diagram each. So that's what I think the focus, and I was not part of the development of the curriculum, but I think the focus was to train these OTD students on that very rigorous process so that they can lead it when they get out to the sites that they're at. Because, again, I think you guys are in a really great place to work that does a lot of that stuff already, but that's not everywhere. So how can we teach our students to do that, to lead that process? And hopefully some of the students will publish some of their work. And we have them kind of working in pairs, and they're all paired with faculty that have interest or expertise in that area that they're in. Mm-hmm. Yeah.
Are you, and you might cover this later, but are you trying to, with our doctoral students that might be coming here for an experience, are you trying to ensure that one of their level 2s was in a hospital-based outpatient setting, or will that vary? It seems like it might be challenging to want to come in entry level in our setting if like your level 2 was in the schools, which was also PEDS, but if we're trying to have them like implement a new program or focus on something very specific, are you trying to match that up?
You know, I think that's a great question, and I think that that's something that we're still trying to figure out. So we do not have a hard and fast rule on that, and jump in if you have something different to say.
So if your site has that hard and fast rule, then that's something that we'll certainly respect.
Mm-hmm.
Because this isn't a level 2 placement, so it really is a negotiation between the site and the students in terms of, is their PICO question, is what they're interested in going to work in the setting or not?
Mm-hmm. And I think that in general, most of them, I'd like if they're going to do something in pediatrics, I talk about that with them in their level 2 matching. If their interest for doctoral experience is pediatrics, then let's make sure they get some sort of pediatric experience. As you know, hospital-based placements are not plentiful. So if I had that requirement, that would be really hard to fulfill. But yeah.
At what point do they know where they're going for their doctoral experience? Is that before or after their fieldwork?
So it's before their level 2, so in the mid. So we're starting here this semester, and it'll go into spring semester in terms of doing this placement.
Yeah, so in their first year, the spring semester, in their first year, they have summer's anatomies, fall is they're doing those first year experiences. And then that winter semester, they're working with me as far as the matching process for level 2s. I request sites in March. I try to let them know matches like July, which gives them 5 months to find housing. And then so after they know in July, then that fall is when we're developing PICO questions and looking at doctoral experience. So again, hopefully before they start fieldwork or as they're on that first one, they'll know what their doctoral experience is. Does that help with the time flow? Yeah. Yeah.
So you will specifically identify these as doctoral experience students.
Absolutely.
We have had some
Other universities.
Slide in like, oh, we need a level 2 placement, and then we get the dates, and it's a 16-week
Right.
placement.
Yeah.
We're like,
We had,
no way.
so Cleveland Clinic called us last year with
Yeah.
that someone wanted a 16-week field work for their doctoral experience student.
Yeah.
So that's why we're doing a lot of education, and I don't think everyone is. But we want you to have that
Yes, I mean, they actually identified them as a level 2, not even a doctoral experience, and then we did not know until like the person was like here for like 3 weeks, and she was telling us different things. We're like, wait a second.
Yeah.
So these will be specifically identified.
They will
and
absolutely
we're not
be.
recruiting at the same time because we don't want to steal our level 2 spots
Right.
with doctoral experience spots.
And I would ask those universities, when you get those request forms or whatever, specifically ask, what's the timeline? What, especially, are you an OTD program? I think those are fair questions. And again, we in the state of Ohio, all of the schools work together to request fieldwork at the same time. And those of us that are OTD programs have had that kind of conversation about doctoral experience requests being at a slightly different time and in a slightly different manner to help you understand that.
They will come like with their like individualized evaluation, like with what their goals are, and those things will be set.
So for us, you're going to be in. So once the mentor is identified, you are involved in that process.
Okay.
A year, almost a year before they come.
Okay.
So it really
Yeah.
is. We want them to help produce products that are useful to you.
Okay.
Yeah.
Because like these haven't had we haven't had that kind of collaboration.
We're just starting to have, like, here in Adams has somebody.
I was going to say, can you talk about Nicole?
Yeah, so Nicole Mayer actually has my student.
I've got it. You talk and I'll
Okay, so
You're going to get these slides, so we are going to push ahead a little bit so you
Yeah.
can get to treating patients. Here's the people, but go ahead.
So last fall, I had a student, Jordan, who identified that she had an interest specifically in pediatric burns. And so we contacted Nancy and we involved Nicole and Lauren Justice, all who kind of treat these pediatric burns, and really involved them in what would be best for doctoral experience, what would be best for fieldwork, and then what are those objectives going to look like? So last fall, Jordan and Nicole were matched up as site mentor and student, and the two of them together wrote their objectives on what is that third doctoral experience going to look like. And so she will be spending time with Nicole in the hand clinic, but specifically in the burn clinic. And then she's actually going to, I believe she's doing some time in the burn clinic even when Nicole's not there. And then she'll be traveling to Maine inpatient for some time on the inpatient unit doing something exactly. We're doing all that confirmation stuff on November 14th. So I could tell you exactly then.
So there you go. So
you have hers.
Here's her PICO question,
Yeah.
which is there, and then just some sample doctoral experience activities. So the PICO, so that systematic review, developing some form of evidence-based guideline and using your format, so it's going to potentially work for you, is great. So that's a small part of it. So for us, the capstone, this written part, meets our doctoral experience requirement for Ohio State for an R1, which isn't the same as other programs because we're different, which we love. We love being different,
We
don't we?
love being different.
So it's just a little slice of that pie. So it could be as small as one patient they're working with, so some type of case study that they're developing. But then there's this other piece of the pie. What are they doing with the rest of their doctoral experience time? And so these are some examples that she's going to be doing. And Nicole's just been awesome in terms of working with, so Jordan had one of her level 2s here, and she wanted to make sure it was very different. The doctoral experience was very different from her level 2, which was great. So these are just some examples. Does this help to clarify it for you a little bit for a real specific nationwide example? So again, one of the major differences between the doctoral experiential component and level 2 fieldwork is that the mentor doesn't have to be an occupational therapist. So here are some examples. An emergency room physician, in the NICU, another physician, a rec therapist, psychologist, teacher, or principal. We have some students that are going to be with both an occupational therapist and then special education providers, physical therapists. So lots of options, again, for the profession to start looking at different opportunities for us that we can continue to grow our fabulous profession. There are very important licensure implications, though. So if the student is billing for occupational therapy services, or if they are calling what they're doing occupational therapy services, then at that point they absolutely would need to be able to be supervised by an occupational therapist. So an example, we'll have a student coming up in the emergency department at Ohio State who will have the physician as their primary mentor, but the occupational therapist who's in that setting when the student is doing treatment will be the one supervising that treatment. But there might be some some things that the occupational therapist does, perhaps as part of a research study that the physician is implementing, might do a balance scale or talk to the person in the emergency room about home accessibility, that sort of thing. So again, if they're billing or providing occupational therapy services, they need to have supervision by an occupational therapist. So ACOTE says that the doctoral experience really is about providing an in-depth experience in one of 8 particular areas. So those areas would be clinical practice, research skills, administration, leadership, program and policy development, advocacy, education, and everyone's favorite, theory development. At Ohio State, I think just because of the nature of who we are, we're really about trying to provide the city, state, country, and world with the best clinicians that we can. So we're really emphasizing the clinical pathway to a large degree. Again, just to help the student be able to find evidence and apply that evidence to actual practice. So as we think about this advanced skills beyond the generalist level, it's hard to think about an occupational therapist developing advanced skills when they're really not licensed yet. So how do we do that? So an example would be perhaps somebody in an acute care setting would focus on, vision for a specific, maybe neurovision, for example, and they would develop some expertise in the assessments around vision. So if we think back to that pie chart, the small chart or the small piece of the pie would be, that neurovision, doing neuro assessments. The rest of the pie would be other typical acute care tasks. And you can think about your own practice setting and what that might look like in your own particular setting. So in terms of scheduling, as we think about scheduling possibilities, students are going to be available roughly mid-November to December 1st, and will be with you 640 hours between that date and April 1st. So if you're taking some time off around the holidays, we can schedule around that so that you don't feel like you have to be there if you're going to take the holidays off to be with your family anyway. The thing that's a little different between this and level 2 fieldwork is it actually says 640 hours. So sick days, anything like that has to be made up. But the nice thing is that 20% of that time can be spent off-site. So they might be able to do some work at home and that sort of thing, and still those hours can count. So as we think about the role of different people within this, there is myself, and I'm the director of experiential education, so I just sort of really help negotiate the contract, that sort of thing with you and your site. Most importantly is the student, as they're trying to drive this experience and really focus on the type of therapist that they want to be as they practice. There's also a faculty advisor that's helping them with that literature review, with the systematic review before they come to you, and then yourself as the site mentor. And so between the 4 of us, it's really about trying to make the best experience possible for that student. So mentorship's a really important thing, and we're going to be providing you with some mentorship resources, but it's defined as a relationship between 2 people in which one person is dedicated to the personal and professional growth of the other. And so the mentor obviously has more experience and knowledge than the mentee, and for Ohio State, typically our mentors will hold some type of state or national license or certification, but obviously needs to be able to demonstrate experience and expertise in one of these different areas. For most of our students, it's going to be expertise in clinical practice skills, but it might be that you're a phenomenal administrator, and so we can pair that up so that maybe the student has some clinical experience, but also has some ability to look at administrative leadership roles, program and policy development as part of what they're doing for their doctoral experience. So in terms of what you're responsible for, it's really completing an online module about your expectations, collaborating with the student and the faculty mentor in the development of the learning objectives. And again, we want you involved in that process early on so that it's useful both for the student and for yourselves. So if there are specific projects that you think would be useful for the student and useful for your site, that's a phenomenal thing. Just like fieldwork, you'll be helping to schedule the student, evaluating the student, and then if there are problems that arise, to contact me, and then we can work through that. The nice thing is we anticipate that there will not be serious problems. We hardly have any problems on level 2 field work, but the students already gone through that process, so hopefully they'll have their real good understanding of what mentorship is. The faculty advisor really is to help the student with their capstone, which again is the written component that's required at Ohio State for graduation. And so the nice thing about that is that the faculty advisor really is also there to support you as well in the development of that capstone. So it might be a really nice opportunity for you to get some close interaction with OSU faculty members. And we're all fabulous. And the student really is about working collaboratively with yourself and with the faculty mentor, making sure just those typical things of what you would expect of an intern or an employee, that they'll follow the procedures of your facility, fulfill everything that you're assigned for them to do, completing the 640 hours, doing some evaluation, and then writing a thank you note at the end. And so we think that there's some really great opportunities for us within the profession. So I really do think there's great benefits that are going to be available to you and your site. We're really focusing on creating useful end products, both for the profession and for your own organization. So there would be some flexibility if your organization has a separate or a specific way that you're going to address evidence-based practice. If you have forms that you use, we have a process that we go through, but we can certainly alter that to meet your needs. You're going to have 640 hours of dedicated student time, and with the changes to our curriculum, we really see that the student is going to come to you at a more advanced level than our new graduates came to you with master's degrees. So we think it's a great opportunity for the student to really explore and develop advanced skill, and for your site to really provide excellent services and up your game in terms of evidence-based practice. It allows organizations and our students to grow into areas at low or no risk. And so when we think about that, we do have some sites that are really seeing this as an opportunity to maybe try a student in a clinic that typically an occupational therapist isn't in, to be able to see or develop a role for occupational therapy in that particular clinic. You have some access to faculty expertise, which again can be really useful in terms of really what's happening in terms of the latest and greatest in terms of evidence. You can get continuing education credit for most disciplines. Most importantly, though, I really do think it helps for us to leave a legacy for our profession. Some of us are able to present, or able to write and be published, but for lots and lots of us that are occupational therapists, we're just good OTs and have developed a great skill set, and so it's just wonderful to be able to pass that on to the next generation. And it really does help you and your organization to train this next generation of practitioners and to help them develop the skills that they're really going to be needing as we continue to face the healthcare change within our profession and within our country. The other thing is it really helps to grow the profession. These are opportunities for students to really focus on their leadership skills and focus on system change and what works and what doesn't work and what we can do to improve things. So that's a wonderful thing. It also gives us an opportunity for the profession maybe to grow into some areas that we're not in yet. So just in terms of future directions, we passed our ACODE visit. We had 2 of them last year, and we're happy that we did well on those. But right now we're recruiting, so especially for the class of 2019 and beyond. So those doctoral experiences, again, will start about mid-November to early December of 2018. So you can help us to identify trends, topics, sites, and mentors inside of occupational therapy and outside of occupational therapy as we continue to grow what it is that we're doing. So we just want to thank you again for your attention today. If you have questions, please feel free to reach out. My email is dennis.clary@osumc.edu. Thanks again and have a great day.